In this video, I'll be taking us through Lagos State Health Management Agency portal. Some information are already provided within the system, such as the provider. We have Hospital 1, which is the primary care, and Hospital 2, which is the secondary care. We have HIA 1, HIA 2, and then a plan called Basic Health Plan has been created already. And then we have some enrollee information already created within the system. And then for the purpose of this video, I'll be enrolling Eniola John, who has a dependent, Eniola Precious, and then after that I'll be doing payment for premium. And after that I'll be looking at how they can access care from the provider and how the provider can submit the claim, if authorization is required, how it's been sent, and then acceptance and other things that are related to the portal. So from here, I will log in with Lashma credential so that I'll be able to show us the data that are already created within the system. This is the landing page for the portal. This is the main menu. And then to see the provider created already, here I have Hospital 1, Hospital 2, Hospital 3. And then we'll be making more reference to Hospital 1 and Hospital 2 for the purpose of this video. And then to add a new provider, all I need to do is to click here and then put in the information required. And then with this information, I can create a provider. For HIA, I have HIA 1 and HIA 2. For the purpose of this training, we'll be using HIA 1 and HIA 2. To create a new HIA, just click on Add HIA, and then you can, data, this can be filled up and you can create a new HIA from there. For the plan, okay, I already have this plan already. That is basic health insurance plan. If I click on this, I'll have the detailed information about the plan. I have for household category is 40,000 per annum, and then for individual is 8,000 per annum. And then I can see the details of this plan. So I can see list of drugs that are covered by this plan, and list of investigation, procedure, and then visit class. I want you to know that this information are just sample data. So these are not the real data for Lashma program. So these are just sample data so that we can have something to walk through within the system. All right, so I haven't seen the HIA, I haven't seen the provider, I haven't seen the plan. We can go ahead and create an enrollee. So let me log out. And then the HIA will do the registration. Go to so from the menu, you will notice that the number of modules that are available is different from that which is available to the Lashma agency. And probably that is for the system administrator or the highest in rank. So the highest in rank have access to all the modules that are available within the portal. Access control is also available within the system, and this can be created when the account is being defined, and this will likely be done by the Lashma agency. So for the HIA, the beneficiary, to create an enrollee, and then from here you can see the list of enrollee for this HIA that are assigned to this HIA. I already have Ogumola Farah and Ogumola Ola, and this is the principal, and this is the dependent. And then for this family too, you can see this is the dependent. The dependent is the one that has a P, and then it has a dependent. So based on the number of dependent, you'll see if it's +1, +2, that's the number of the dependent. And then for Williams Femi, this is the principal, and it has 0 dependents. And then from here, you can see the Lashma ID, you can see the date of birth, local government, the HIA, to which they belong. So by default is HI1, so they're already tied to HI1, and then the policy is active. So for me to create a new beneficiary, click on Add Beneficiary, select Male, and then title. That is Mr. Then I have Eniola John. And then I can fill in other information in here to make up for this. So, okay, yeah. For the phone number, and then the date of birth. Okay, I can just even come in here and then just put in the year 2080. And then for the last my date, that can be skipped. State of origin, legal state, local government, or Badagry. The marital status, married. Number of dependent, 1. And the residential address, just type in Lagos in here. And then SCD of residence. Yeah, Badagry. And then neighborhood. So, and then from there, if there's a need to attach image, that can be done. If we scan document, if you scan a photograph, that can be done here. Then you can use the web camera for you to take the picture as well. And from here, I can click on next. And then to the dependent, this female. I choose as a Mrs. Okay, Biola. So Biola. And the email is the phone number. Then the second phone number available. If not, you can skip that. And then this is 1990. And the relationship. And then as well, you can, sorry, I'm just trying to, so this can be, so we can use the calendar. For instance, I can change this to June. You can say it's June 11, 1990, relationship, a spouse, and then let's try if that is available. If not, you can add. So if I want to add a new dependent, all I need to just to click on this add if there are multiple dependent. But for the purpose of this, we only have just one dependent. I click on next. And then from here, so HI1 is the one registering, so by default. So this is the health insurance agent. And then the primary care provider. So I have hospital 1. And then for type, so I have for my insurance. And then from here, I can pick basic plan, and then the category is household. I have the premium package, that's 40,000. So if you have multiple package, for instance, when we have, let's say we have a basic health insurance plan we have for household, maybe based on size of household, but these can actually be configured to what is required. It's flexible, it's dynamic. And then if this enrollee is being sponsored by an organization or by a company or by a sponsor, so that can be selected here, but that would have been, I mean, the organization would have already been created within the system. So if it's covered by an organization, so we can take from here, you can pick the sponsorship type, and then from here we can select the organization. But I've not created any within the system. We can come back and look at that. So, but for this is a self-sponsored. So from here I can click on next. Okay, so from here I have this created already. I have the principal, I have the dependent, and then um, I have an SMS already sent. So that indicates that a policy, what's it called, sorry. Let me just, okay, that HIA1 created the insurance policy on my behalf with policy ID P00006. And then I have a Lashma ID 18050015. Okay, so that is it. Okay, so for me to go ahead and then uh, pay for this policy, all I need to do is just to proceed to policy payment portal. And then from here, you can see that I have no history of any previous payment for policy. Then click on pay premium. And then this shows the details of the policy and what I'm paying as premium. And then we have different channel by which this can be, can be made. We have by e-payment, we have by cash, by check. Supposed to bring out, redirect this to Flutterwave. So I don't know why that's not running currently. So, but I can check later. So, but I can do cash payment and then pay this 40,000 and then I can click on OK. And then payment is made, but this policy is not yet active. So go back to personal details, and then from personal details, you can click on approval. And then from here, you can click on activate policy. So this is activate the policy, and then the premium is activated. So this is all that is required to create an enrollee. Created. I mean, the enrollee has been created. So the next thing is for this enrollee to be able to access care. So this enrollee goes to provider 1. And then so we've done all this, we'll be able to create this enrollee. And then we have a pay premium activate policy. This is done. So the next is access care and then submit claim. So I really want to access care and then I've logged in as a provider 1, that is hospital 1. And then once the enrollee shows up, so what the first thing to do is for them to, they can go to the list of their beneficiary, they can confirm that this enrollee exists. So this enrollee is actually tied to provider 1. And then you can see that from here, and then you can see that the policy is active. So this is the list of enrollee. So, and then the list of active beneficiary. All right. So the next thing is to do a check-in for the enrollee to access care. Now we have new check-in. and then you search for the enrollee. Then you have Eniola. Then for me, I have Eniola, John, and Abdullah. So depending on who wants to access care, the principal or the dependent. So if it's the principal, click on this. And then for the system, for the platform to verify the authenticity of the enrollee, an OTP, that is one-time password, will be sent to the registered phone number of the enrollee. So I click on generate OTP. So OTP generated, I click on OK. So the OTP will be sent to the enrollee registered phone number. Wow, right on time. So the next thing is for me to type in the OTP that is sent. I have HTED. Then I click on verify OTP. Okay. So if it's an outpatient or is an inpatient, that will be selected, and then the date of encounter, which is today. So and then for the OTP will be sent to the enrollee registered phone number, and then the enrollee will provide this information to the provider. And then click on check-in. Okay. So from here, if it's just to generate claim, for instance, what we have as our first task is to access care and submit claim. So what the provider needs to do is to click on generate claims. And then from here, the provider simply select the visit class. Let's say for eye examination. And then what are the symptoms? So from here, you can search for symptoms. Let's say itching. Okay, and then duration. Let's say duration is in 1 week. And I can pick 1 week here, and then I can add this as a symptom. Okay, so from there we can move to diagnoses. So the provider can select diagnosis, maybe, okay, let's say the working diagnoses. So working diagnoses, we have allergy. Okay, you can add as your diagnosis. And then if there's any investigation required, so if an investigation was done, that can be added. And then if there's any drug given, let's say paracetamol, and that's the closest. Okay, one sachet, you can add that as drug. And then with that, so we can go to notes. So just permit me to put neo. Permit me to put just put N here. And then okay. And then the doctor. And then the unit of the doctor, let's say OPD. And then this will be safe. All right, so the claim has been sent, and then you can see that this claim is still pending. So that can be reviewed, and then that is approved. Let's see what the HI will be saying. All right, so from there, this belongs to HI1, and the login as HI1. And go to claims. Then HI1 is saying this information. I can click on this. and then they can see all this information, and then they can just simply approve. Okay, so you can see approve request, and then with this, we've been able to access care and then submit claim. So in the next instance, we'll be looking at how to make referral and then authorize such referral by the HIA.